If you are over 60 and struggling downstairs, you might not need a blue pill. You might just need sunlight. In this video, we are revealing the one specific vitamin deficiency that affects nearly 50% of men your age and, according to the NIH, directly kills your ability to perform. We aren't guessing. We're using fresh data to fix your levels. We're going to cover the endothelial connection, the exact dosage you need to avoid toxicity, and the one critical cofactor you must take with it to make it work. Let's get started. Let's start with the hard truth many doctors miss: your vitality, your strength, energy, and sexual performance. It all rests on a foundation. That foundation is not willpower. It is nutrition and basic biology. If you are a man over 60, statistically, you are likely deficient in this critical compound. We are talking about vitamin D3. It's not actually a vitamin. It functions as a powerful steroid hormone inside your body. Here is why this deficiency is an epidemic for gentlemen your age. As we pass 60, our skin loses its efficiency. It doesn't convert sunlight into D3 as easily as it did at 30. We also spend less time outdoors. Many of us use sunscreen diligently, a good practice, but one that blocks vitamin D production entirely. The medical community has focused on vitamin D for bone health for years, but the modern research paints a far more serious picture. We now know that low vitamin D is more than just weak bones. It is a silent alarm bell for your cardiovascular system. Think of your body's plumbing. Everything depends on smooth, clear arteries. When your vitamin D levels fall too low, the body struggles to regulate blood vessel health. The result is often the first, most visible sign of a system under stress: difficulty achieving and maintaining powerful erections. This isn't a bedroom problem. It's a blood flow problem. So, what is your first, most actionable step today? You must stop guessing. Before you spend $1 on supplements or prescription medications, you need a baseline. Ask your doctor for a 25-hydroxy vitamin D blood test. This simple number is your key to unlocking greater vitality. Knowing your level is not a diagnosis of failure. It is the beginning of control. Once you have that number, you know exactly how far you need to go to rebuild your health. Subscribe to Gentleman's Vitality now. We cut through the noise and give you actionable, science-backed strategies to help you master these exact problems every week. Now that you know you need to test, let's explore the mechanism. How does a simple vitamin or hormone technically make such a difference in the bedroom? We call this the endothelial connection. The endothelium is the delicate single-cell lining of every blood vessel in your body. Think of it as the non-stick coating on your vital pipes. A healthy endothelium is flexible. It knows how to relax, which is essential for blood flow. When an erection is needed, the body releases a crucial signal molecule called nitric oxide. Nitric oxide is the master vasodilator. It tells the endothelium to relax, allowing maximum blood volume to rush in. Without nitric oxide, there is no effective expansion and no powerful erection. Here is where vitamin D enters the story. Research shows that D3 is absolutely essential for the maintenance and healthy function of those endothelial cells. When D3 levels drop, the endothelium becomes stiff, inflamed, and less responsive. It loses its ability to produce or use nitric oxide effectively. Imagine trying to inflate a stiff, rigid garden hose versus a new, flexible one. the mechanism of blood flow fails. Studies published in journals like the Time Journal of Sexual Medicine consistently show a direct correlation. Men presenting with severe erectile dysfunction often have significantly lower vitamin D levels than men with normal function. They found that low D3 was an independent risk factor. It wasn't just linked to poor diet. The D3 itself was a problem. This is a scientific fact, not a theory. This realization changes the entire treatment landscape. If the foundation of your blood vessels is compromised by a deficiency, forcing blood flow with a pharmaceutical is a temporary patch. It doesn't fix the underlying problem of vessel stiffness. Fixing the vitamin D deficiency is foundational. It's like replacing old, stiff hoses with new, flexible ones before turning on the water pressure. But supplementing D3 isn't as simple as grabbing the cheapest bottle at the pharmacy. There are major caveats, especially for men over 60 trying to boost performance. You need to understand the difference between D2 and D3, and crucially, you need the right cofactors. The wrong approach can be ineffective or, worse, potentially harmful to your arteries. We'll cover those critical safety measures later in this video, so stay tuned. The next few minutes will define the exact numbers you need to target for optimal performance. If you have taken that blood test, you now have a number. But what is the ideal number for a gentleman focused on peak vitality, not just avoiding outright deficiency? Most labs report anything over 30 nanograms per milliliter, or nanogram per milliliter, as sufficient. But that target is set to prevent rickets, the bone disease. It is not set for peak performance. For optimal heart health, hormonal support, and maximizing that endothelial function we just discussed, the evidence strongly suggests aiming for a range between 50 and 80 nanograms per milliliter. If your number is below 30 or worse, below 20, you have a serious deficiency. You need a focused, higher dose approach under medical supervision to rapidly increase those levels. If you fall between 30 and 50, you are functionally deficient for performance. You are likely leaving significant vitality gains on the table. Achieving this target range requires consistency and precision. This brings us to the crucial difference between vitamin D2 and vitamin D3. When you look at supplements, you will often see both. D2, or ergocalciferol, is the plant-based form. D3, or cholecalciferol, is the form your body naturally produces from sun exposure. The research is clear. D3 is significantly more effective at raising and sustaining blood serum levels. It is the bioidentical form your body recognizes and uses best. Always look for vitamin D3. But absorption is half the battle. Remember, D3 is a fat-soluble vitamin. Your current multivitamin is likely doing almost nothing if you take it on an empty stomach with a glass of water. It needs fat to be absorbed across the intestinal wall and put to use. The simple, actionable takeaway here is to always take your vitamin D3 with the largest, fattiest meal of the day. This could be your breakfast with eggs and avocado, or dinner with olive oil and salmon. Taking D3 with fat can increase absorption by 50% or more. Without fat, much of that expensive supplement simply passes straight through your system and is wasted. Now, let's talk dosage. We cannot give specific medical advice here. Your doctor must determine your exact dose based on your blood test results and body weight. However, Research suggests that for maintenance, once you have reached your target 50 to 80 nanograms per milliliter, most men over 60 require between 2,000 and 5,000 international units, or IUs, daily. If your levels are extremely low, you might need a much higher loading dose for a short period, but never start a high dose without physician guidance. You must treat D3 like a hormone, not a simple supplement. Taking too much D3 without proper oversight can lead to hypercalcemia, which is too much calcium in the blood. And that brings us to the safety valve that 90% of men miss when supplementing D3. This next compound is the difference between healthy arteries and stiff, calcified ones. The risk of hypercalcemia, or elevated blood calcium, is why many men fear high-dose vitamin D. You want strong bones, but you definitely do not want calcium settling in your soft tissues, like your arteries. When calcium hardens the arteries, it is called calcification. This is the opposite of the flexible, healthy endothelium we are aiming for. Fortunately, nature provided a perfect antidote and director, vitamin K2. Think of vitamin D3 as the traffic cop that lets calcium enter the bloodstream after you eat. Vitamin K2 is the second traffic cop that directs that calcium. It tells the calcium, "Go here," to the bones and teeth, and powerfully signals, "Do not go here," to the soft tissues and arteries. Taking high-dose vitamin D3 without its partner, vitamin K2, is effectively like inviting guests to a party and then locking the doors to the venue. The guests, the calcium, end up floating around where they should not be. This is a critical point for any man over 60. Arterial flexibility is paramount to both heart health and sexual function. You must ensure you are getting enough K2, specifically the MK7 form, alongside your D3. This combination of D3 and K2 is often called the D3-K2 complex. K2-MK7 is particularly effective because it stays active in the body longer than the K1 form found in vegetables like spinach. The recommended pairing is straightforward. When you take your D3 with that fatty meal, take your K2-MK7 at the same time. This synergistic approach maximizes bone benefit while simultaneously safeguarding your arteries. But D3 does more than just fix the plumbing. It addresses the fuel. The second major benefit that restores vitality is its relationship with testosterone. Testosterone is the primary driver of male libido and vigor. Without sufficient T levels, the desire for sex and the ability to respond often diminish, regardless of blood flow. Vitamin D acts as a steroid hormone itself, and it is intrinsically linked to testosterone production. Multiple human studies have shown that men with higher vitamin D levels consistently have higher free and total testosterone. One study from Graz Medical University in Austria found that men supplementing D3 saw a significant increase in their total T levels over just 1 year. This is powerful evidence that this isn't just a flow fix, it's a hormonal upgrade. This connection highlights the ultimate power of this approach. We are not just forcing a reaction, we are restoring the body's natural ability to produce the hormonal signal that initiates performance, while also ensuring the physical delivery system, the arteries, is functional and healthy. This foundation must be stable before any other supplement or pharmaceutical can truly maximize its effect. Now that we've covered the D3K2 combination, we need to talk about the final mineral piece that locks this entire system into place. The third element in building this powerful foundation is a mineral that every man needs, especially those focused on testosterone and vitality: zinc. Zinc is the ultimate partner for D3 in the male body. It is heavily concentrated in the male reproductive system and is absolutely necessary for producing testosterone. Think of zinc as the factory manager in the testosterone production line. If the manager is absent, production slows down dramatically. Furthermore, zinc deficiency is incredibly common in seniors. Certain medications, especially diuretics for blood pressure, can deplete zinc levels rapidly. Even mild long-term inflammation can drain your reserves. When you stack vitamin D3 and zinc, you create a hormonal and physiological powerhouse. D3 provides the hormonal signal, and zinc provides the raw material needed to respond to that signal. If you fix your D3 levels but remain deficient in zinc, your body may still lack the necessary building blocks to fully optimize testosterone production. So, how do you incorporate this? Most men benefit from supplementing a small, manageable dose of zinc daily, typically around 15 to 30 milligrams. But timing matters. Zinc can sometimes interfere with the absorption of other minerals, especially copper. The best practice is to take your D3 and K2 with your fattiest meal. Then, take your zinc supplement later in the day, perhaps with a smaller snack or just before bed. This ensures maximum absorption for all three critical components. Now let's address the obstacles. You might be saying, I take a multivitamin every morning. Isn't that enough? The simple answer, regrettably, is no. Most commercial multivitamins contain woefully insufficient levels of vitamin D3. They might offer only 400 to 800 IUs, which is often enough to keep a 20-year-old from getting rickets, but completely inadequate for an older man with absorption issues trying to hit the optimal 50 to 80 nanograms per milliliter range. Second, multivitamins often use cheaper, less bioavailable forms of vitamins, and they rarely include the essential K2 component. You need targeted supplementation for targeted results. This is not about taking a generic pill. This is about precision nutrition for specific goals. Remember, this entire strategy, fixing D3, adding K2, and supplementing zinc, is foundational. It's about building a robust biological environment. It is the work you do before any other intervention can be truly successful. But a pill alone is not the entire solution. The final pieces of the puzzle involve simple lifestyle shifts that amplify the power of these supplements dramatically. To truly lock in the vitality gains from D3 and zinc, we must talk about the simple, everyday actions that seniors often neglect. There are two primary amplifiers that multiply the power of these supplements. The first amplifier is sunlight exposure. Even though our skin is less efficient at converting light as we age, direct sunlight still provides massive benefits beyond just vitamin D production. Sunlight exposure helps regulate your circadian rhythm, lowers blood pressure, and boosts mood, all factors that indirectly support sexual function. Aim for 15 to 20 minutes of direct sun exposure on exposed skin, forearms and face, midday, whenever possible, and only when safe. Remember, this is not sunbathing, it is strategic exposure. This supports your body's natural cycle and keeps that vital hormone system responsive. The second And perhaps most powerful amplifier is simple resistance training. When you lift weights, even light weights or resistance bands, you send a potent hormonal signal throughout your body. Resistance training is a natural, free way to boost endogenous testosterone production. This directly supports the hormonal foundation that D3 and zinc are working to build. A man who supplements correctly but sits all day will see minimal results compared to the man who supplements and engages in a 30-minute strength routine 3 times a week. The synergy between the supplements and the activity is undeniable. Let's review the entire protocol as a unified system, making it easy for you to integrate starting tomorrow. First, get your baseline test results. Know your D3 number. Second, target the optimal range of 50 to 80 nanograms per milliliter. Third, source high-quality vitamin D3, not D2, and always take it with a source of dietary fat, like your breakfast or dinner. Fourth, pair it with vitamin K2, specifically the MK7 form, to safeguard your arteries and ensure calcium goes where it belongs, the bones. Fifth, ensure you are taking 15 to 30 milligrams of zinc, ideally later in the day, to keep that testosterone production line moving efficiently. This entire protocol is foundational. It's practical, evidence-based, and avoids the wild, unproven claims you hear elsewhere. This is what we mean by mastering your health at 60 and beyond. This is about building a body that works for you, not against you. And this brings us to a final, crucial point about consistency. Consistency is the secret ingredient that turns good information into real results. You must understand that fixing a deficiency that took years to develop will not happen overnight. Vitamin D, specifically, takes time to build up in the bloodstream. You might need anywhere from 90 to 120 days of consistent, correct supplementation to see your levels reach that optimal 50 to 80 nanograms per milliliter range. This requires patience and commitment. Do not start this protocol, try it for 2 weeks, and decide it failed. This is not like taking a pharmaceutical that generates an immediate effect. This is about deep biological repair and rebalancing. Set a schedule, stick to your chosen doses, and retest your blood levels after 3 to 4 months. That follow-up test is your proof of concept. That new, higher number will validate your hard work and confirm that the foundation is finally stable. Another frequent objection we hear is about cost. Compared to long-term prescriptions for erectile dysfunction, the cost of high-quality D3, K2, and zinc is minimal. View it as an investment in preventative maintenance, not a temporary expense. Investing in this foundation now saves you far more money and hassle down the road by supporting both your cardiovascular health and your long-term vitality. We also need to address medications. If you are currently taking blood pressure or cholesterol medications, you absolutely must consult your physician before starting any new supplement regimen. While D3, K2, and zinc are generally safe, your doctor needs to be aware of everything you are taking to ensure there are no unintended interactions or effects. The goal is coordination, not secrecy. Make your doctor your partner in this quest for better health. This commitment to consistency and medical awareness is what defines a gentleman of vitality. It means cutting through the noise and focusing on the few things that truly move the needle for men over 60. By fixing this silent D3 deficiency, you are not just targeting performance, you are simultaneously boosting your bone density, improving your immune function, and protecting your heart. You are addressing the root cause, not just the symptom. If you found this scientifically rigorous, actionable strategy helpful, please take 2 seconds to hit the like button on this video. That simple action tells YouTube that this information is valuable for other gentlemen seeking real, evidence-based solutions. Now that you have the full D3, K2, and zinc protocol, I want you to focus on the next step in optimizing your male vitality. Click or tap the video on your screen now, where we break down the 3 hidden lifestyle habits that are secretly crashing your testosterone levels every single day. Take control of your health today and live a stronger, healthier, and more vibrant life.